Unexplained infertility is one of the most frustrating diagnoses that a patient can receive. Fortunately or unfortunately, it is a diagnosis that's recognized in our industry. But in my mind, it's also the laziest diagnosis. It means that your doctor stopped looking. It means that your doctor's given up on trying to figure out why you're not getting pregnant, and now they're just using a bunch of different tools to just get you there. It's important to understand that there's multiple variables that can actually play into this. It might be their thyroid. It might be their hormonal environment that they're in. Or it might be something a little more sinister, like silent endometriosis. What it means is that when you're dealing with someone who has the diagnosis of unexplained infertility, you need to stop and take a look to figure out what's actually going on, instead of just continuing to move forward through treatments without actually a clear diagnosis for what you're treating. Unfortunately, the more patients I see, the more second opinions that I do, I see more diagnoses of unexplained infertility. I think this might be a function of the fact that we're all so busy and we're seeing so many patients that sometimes the diagnostic pathways are very short. So people are almost giving up that diagnostic pathway very easily to just say, oh, it's unexplained. Other times, someone's gone through countless cycles and they have not achieved their goal of their baby. And so in the end, someone just diagnoses them as unexplained because nothing else is showing up. Fortunately or unfortunately, different providers have different clinical pathways and different tools that they deploy to diagnose their patients and treat their patients. So what happens is that when you see a patient, for example, for a second opinion, their doctor may not have done the full gamut of tests that are available. They've only may use the tests that they use in their clinic on a routine basis. So unexplained infertility at one clinic could be clearly endometriosis at another clinic.